Namaskara, welcome to yet another episode of Maitraya. Today we have a very special guest, Dr. Tapaswini Pradhan, head and neck cancer surgeon from Apollo Hospitals, Delhi. Dr. Tapas, firstly I would want to tell you that you look so serene, so spiritual, so smiling. Such a pleasure talking to you about a concept, a topic that is so widely misunderstood, like cancer. Coming to your journey, so when did it start, and to this day, how do you feel as a cancer specialist, as a doctor dealing with patients with this deadly disease day in and day out?
Right. I mean, the journey has been fairly long. It's been 23 years, and the experience has been with various government and corporate institutions. I would say it's been a roller coaster ride for me also, and I have learned a lot professionally, and also it has revealed a lot of facts about life, meaning my in-depth perception of the journey of life has now become so much better. So this I understand a lot through my patients who undergo so much of psychological trauma, yet they can still smile through all the adversities. So it teaches a great about how one can be so resilient, how can one be so positive, and how can one view life which can be so, I would say, you would say that it has been not something which has given them really a great, cancer, meaning it's a death sentence. But here you would see patients who are your motivators, in spite of the fact that they are being rigged through and grilled through such a deadly disease, yet they come with so much of positivity, and that vibe which they give is something which I've learned. And that's the reason why you see me so calm and serene and spiritual.
It's so nice, listening to you. We can listen to you the whole day because your voice and the way you put the words across, it's really nice to see doctors like this.
Thank you.
Talking about women and cancer. So today we will be talking a lot about women-related issues. Coming to the most common cancers, breast cancer and cervical. How do you take this forward in terms of when a patient comes to you and when you are supposed to tell them that they are diagnosed with this disease as such? But how do you start the entire process of counseling, and how do you start the process of telling them that yes, they need treatment?
Whenever you reveal the patient that you have this deadly disease, it is not a very easy thing even for a doctor. So it's an art. It's an art. So when you talk to the patient, you have to be very, very meticulous in analyzing the emotions of the patient. That's why we spend hours and hours with the patient talking. Revealing that the patient has cancer is always done on a very soft note. But when you reveal, you also feed them with a lot of positivity. Because unless they go through, unless they are given these positive vibes, they will never be forthcoming for the treatment. So instead of showing them the darker side of the disease, it's always better to tell them that yes, though you have cancer, things have changed. Sciences has changed, your understanding about the disease has changed. There are a lot of changes which has happened in the treatment protocol and therapies, that survival in most of our cancers has dramatically improved. As I said at the start, that it initially used to be like a death sentence, which is no more. So you see such beautiful, inspiring stories of cancer survivors. So that's what I would say. Whenever we reveal it in a very soft, subtle manner, but then simultaneously feed them with so much of positivity that they feel yes, they will be able to cope up with the stress, and then they will be compliant for the treatment.
Do you have any words of positivity for people who are watching us and who are taking treatment and who are undergoing to get rid of this disease?
So life is like a book, and each page of it is teaching us something every day. And it is like a roller coaster ride for each one of us. So there may be many who have been afflicted with this disease, but yes, these diseases can be fought with a lot of courage. And there was a survivor who beautifully said that this word, cancer, which is a 6-lettered word, helps you to discover yourself. And this 6-lettered word, cancer, can be fought with another 6-lettered word, which is called prayer. And P here stands for positivity. R stands here for resilience. A stands for adapting to the new changes which the body is experiencing. Y stands for discovering yourself. E stands for enjoying every moment, because it's like a pause. In this fast-pacing life, when you have a disease like cancer, it's probably God sent, which says that pause for a moment and see what have we done to our, it's a reflection on your lifestyle. And then the R is rejoicing with your family members. So it also gives you a lot of time to spend with your family members. So I would say if you take this 6-lettered word and digest this word prayer and incorporate when you are sailing through this journey, you can beautifully fight this disease.
During recent times, the research and development says that cancer can be detected before it really crops up in the body. Is it true?
Correct, yeah. So if we look at the research and the potentials of the research, it has gone so deep that they have been able to analyze the various genes in our body, which on mutation can produce a particular type of cancer. So as we were discussing about breast cancer, you get BRCA gene. So that's predominantly a BRCA gene driven cancer. So it's a BRCA1 and a BRCA2 mutation. So here I would love to get the story of Angelina Jolie. Angelina had a very strong family history. Her mother, sister, Marcy, her aunt and all. They all had BRCA positive mutation and they all had breast cancer. So when she got herself analyzed, she was also positive for the mutation. And that's the reason why she underwent a prophylactic mastectomy, which means that both the breasts were removed before the disease appeared.
Oh, is it?
Yes. And she's become an example, and also some, we also give inputs to our patients, see how this particular therapy has been useful. Prophylactically means before the disease appears, you've taken that organ out. So when that organ is not there, there will be no possibility of you or the individual developing that cancer. That's how we have come. And other also, like in our specialty, like thyroid cancer, there's something called medullary thyroid cancer, and it's a mutation which can happen in a red gene. The codons in that gene, when they are mutated, either it will be an aggressive variant or the different kinds of So when we do analysis on a newborn child, and if this child is positive in that gene for a particular mutation, surgery is performed even as the child will be as small as 6 months.
Oh my God,
that's the beauty, and these are called the next generation sequencing. It has a huge panel of genes, and you can study the mutations in these genes, and you can predict whether an individual will have or not. And that's where the role of these prophylactic surgeries are coming, which in other words would mean don't allow the disease to develop at all. So once it is not there, so these patients would be much better, faring up better in their lives.
Absolutely.
And then research, the other things also that we have technological advancements in surgical field. If you look at radiation, even technology of delivery of radiation has become so much better. And in medical oncology, they have come out with newer therapeutic drugs, chemotherapeutic drugs, targeted drugs. Immunotherapy is now coming in a big way. As a result, the treatment has become more intense with less side effects, with lesser morbidity, and in turn is giving a better quality of life and also better survival.
Absolutely. I mean, it's brilliant to know that, before the body crops up with these degenerated cells, already diagnosed, that's actually fantastic to know.
And the other also, you can make out relapses and failures in certain blood tests. There are tumor markers. So these tumor markers can tell you in real time that the disease is coming up. So you can handle this relapse or recurrence much faster before it becomes florid.
True. This requires screening, right? This requires tests to be done frequently.
Yes, that is the reason why all cancer patients are kept on an intense surveillance. And the surveillance has to be lifelong. Remember that disease-free, there are stories where patients have been disease-free for 10 to 14 years.
And then it's relapse.
So surveillance throughout life is a message which has to go to all the survivors. So if we see globally, breast cancer is the most common cancer. In India, we have a picture which is slightly different. There's a rural and the urban divide. And rural India sees a lot of cervical cancer, while urban India sees breast cancer. But then there are other cancers like ovarian, esophageal, head and neck cancers.
What are the early signs of breast cancer?
Amongst the females, breast of course ranks the highest, with cervical cancer in the rural setup and head and neck cancer in the fourth position, ovarian in the third. So these are the 4 main cancers which affect the human body is a beautiful machine, and it's got an antivirus which throws signals, warning signals from time to time. But this disease is a mysterious disease. Cancer many a times fools the body. That is, if you look at breast cancer, 50% of the times patients don't have any symptoms. And that's the reason why we emphasize a lot on screening. Because screening means when you are actually analyzing healthy individuals, people who don't have symptoms. But there are the rest 50 will either present with lump in the breast or in the later phase of the disease. There may be nipple retraction, nipple discharge, which could be bloody, or the skin over the breast may have some changes, maybe puckering, or there may be in the axilla a palpable lump. So these are majorly the way patients present to us. So if the presentation is there, most of the time it is in the form of a lump. But then a word of caution to our listeners is that every lump is not cancer. And why I emphasize this is because if we give this information saying that every lump is cancer, everybody will be so scared and will not be forthcoming to come to a specialist to show this. So whatever is being felt abnormally in the body should be at least ruled out for diseases like this.
How often does the screening work? How often should we go for screening?
It's not a very routine done protocol in our country, but yes, if you look at countries, Western countries, they are quite strict on the screening. Now, screening protocol is different for different types of cancer. If we look at breast cancer, then we have to categorize our patients. There are women who are in the high risk, meaning they have a strong family history. If you have mother, sister, your siblings, and your first degree relatives, it is that the woman should be screened much early in her career. Or if you have received radiation to the chest area because of some other disease, again you are in the high risk. Or there are certain pathologies in the breast which again warrant screening early. Otherwise, most of the screening of women is done either after the age of 40 or 45 years. But when you are in the high risk, then first of all, the warnings and the institution of screening protocol and surveillance should start as early as 18 years of age, where you teach the girl how to do a clinical examination of the breast. And then the proper radiological screening starts at 25, which is generally done with the help of MRI or ultrasound. And then above the age of 30, and it's done either with mammograms, so these are screening mammograms, or MRI. So these are radiological investigations, and most of these protocols are annual. And after the age of 55, it becomes bi-year. But having said all this, what's really important, so it doesn't assure you that nothing will happen in this 1 year. That's the reason why we tell our patients must do a clinical self-examination of the breast, which is very easy, and you can all log into the YouTube and see how a self-examination of the breast is done.
I think that sounds good because absolutely to go to a screening also it's very intimidating for girls or for women because I mean, like you said, to hear the word cancer itself, it's very, very scary.
Correct. And this is something which you can do at home.
Okay.
So you don't have to be dependent. But if you know it, how to do it properly and accurately, then 36% of the women have picked up the lumps which are found to be cancer. So that's that beneficial.
Dr. Tapas, I would want to ask you one thing. Why do most of them get screened or get diagnosed at stage 4 or stage 3 when nothing can be done much? I mean, is it the problem with the community or, I mean, there's a lot of awareness that's been, provided in terms of get your screening done, get your regular checkups done, but still they get diagnosed maybe at the later stages.
See, a lot of it is, one, of course, ignorance. Whatever awareness that we may be talking about, we need to analyze how much is it reaching to the masses. Secondly, fear. As I said, the word itself which censures. People know, the educated class knows that a lump may be cancer. So that fear itself causes a lot of postponement. And then the fear of the treatment. The fear can be of varied kinds. One of the disease, of the treatment. Who would like the breast to be chopped off? We all know the treatment may involve removal of the breast. Fear of employment, fear of relationships, betrayal in relationships, where spouses you find they split. The moment the woman is diagnosed, the husband just quits. So there are so many different types of emotions which this disease can evoke in an individual. So that's the fear factor. And the third is accessibility to the treatment. There are places where cancer institutions are not in the vicinity. So people have to travel long distances. So that itself causes a delay. And then resources, finances, it is a draining exercise. It is not something which finishes in a couple of months' time. Sometimes it goes for years and years together. So all these factors do contribute as to why our patients come in late. In fact, if you look at statistics of breast cancer, only 5% of our patients are diagnosed early. Look at United States, 85% are diagnosed early. So look at the stark difference. And that's because of a lot of our social, environmental factors which are contributing.
So maybe in the next 10 years or 20 years down the line, do you think we might be somewhere where United States are, or how do you see the future of the
Yes, as more and more awareness programs are being generated, I think the government is also taking a lot of initiation in these programs. A lot of activities are happening through hospitals, NGOs, so we may be able to reach the masses better. And more hospitals and cancer setups are being built all over our country. So that will make the accessibility for treatment more easier for people. So hoping, I mean, it's again looking at from the brighter aspect, maybe years down the line, our patients will be more forthcoming and we'll have better survival results.
I think that's well said. Coming to people who travel abroad for cancer treatments, is it really required? I mean, does our country have the necessary developed treatments or developed procedure? Should it be done here? Or many people wouldn't want to get it done here. What is your take on that?
One beautiful thing which I would say is, if you just look at the doctors who are treating abroad, majority of them are Indian brains.
Absolutely, that's
Right?
true.
The difference is coming in the quality of the drugs
Okay.
that is being delivered there. Nevertheless, the Indian patented drugs are no less. But yeah, somewhere they do fare up in their quality. But the treatment for any cancer has an international protocol and guideline. But as I would say, one treatment doesn't fit everyone. My Indian built makeup of an Indian patient will not be the same as that of an American. The body is the same, but the biology and the physiology will be different. So his tolerance to a certain drug may be very different. So the dosaging will be different. While an Indian patient, it will be different. So there may be some changes or there will be some permutation and combinations which you have to tailor make according to your individual. So it has to be individualized also a good number of times because of your general condition of the patient. The other is the disease, maybe so advanced, and then the third is finances.
True.
Every patient, as I say, are not Tata Villas. So every patient cannot afford the standard treatment. So you have to customize to many things and we have to offer them in a different way. Nevertheless, I would say we don't compromise on our treatment. But then as I said, one size doesn't fit all. One treatment doesn't fit all. So we can't compare ourselves with patients abroad. And we should not. So as I said, comparison, competition.
Yes, remember these two words.
Yes.
Dr. Tapas, you just said lifestyle is important, like you just said about meditation and yoga, and a lot of changes required once the patient is diagnosed with cancer. So what according to you are the lifestyle changes that can be incorporated?
See, first of all, we should understand what we mean by lifestyle. For most of us, lifestyle means the way we live, the way we conduct ourselves. But then lifestyle also has a very deep meaning. It is not just what you eat and how you live, it's also what you think and what you speak. So that has a tremendous bearing on what happens to the various hormonal and the chemical changes which are happening in our body. If you look at these cancers, the good thing is, it's an evil. Cancer is an evil. But what is the good aspect of this evil is that it's highly preventable. 30 to 50% of our cancers are lifestyle based. They are environmentally induced. So, which means it is under our control. Now, I would say, suppose if you are considering breast cancer, or any cancer for that matter, one beautiful thing which all our listeners should hear is remain as close to nature as possible. Nature has certain rules and laws which our ancestors have analyzed or have realized its value, which over the generations has deteriorated. Meaning, look at breast cancer. If you look at the causes, late marriages, nulliparity, having no children, opting for not having children, which means no breastfeeding, which is so protective. Then postponing childbirth by using over contraceptives. So you take for years and years together, not realizing what it is doing to the body. Hormonal therapies, post-menopause, just to reduce your problems associated with menopause. So we adapt certain therapies. Then having alcohol in our lives. What provocational stress most of the time. So it's linearly proportionate, meaning the more you consume, the more closer you come to these diseases. So habits. And then inactivity, sedentary lifestyle. So with commercialization, urbanization, our lives have changed dramatically. So we've had a lot of comforts with so much of technological advancement, but then in turn what has it done to our system is we have become so inactive. So this sedentary lifestyle, obesity, if I say sedentary lifestyle, getting on to increased body weight, increasing BMIs. So if I count the cancers, there must be more than 20 colon cancers, which are just related to our body weight. So breast, ovary, uterus, esophagus, gallbladder, pancreas, kidney, lymphomas, multiple myelomas. So the list is long. So this is something which is you can do, you and me can do. It is preventable. Then the other is when we become a type A personality. We are stressed out. Stress has become, it is a constant companion in times of now. 21st century, if you are talking of and you say you can work peacefully without stress, probably it's not correct. And stress, the value of stress in our lives is it keeps us going. If you take it in that positive sense. But then if stress becomes a killer, then of course it's going to harm our system. And then diet. So how did I say? Come close to nature. But then in a fast-pacing life, we will resort to junk foods, processed foods because they are easier to do. And so the nutrition of our system, you have robbed off your body of the nutrition. So with processed foods, the taste and the flavor may be good, but then it has robbed your body of all the nutrients that it requires to run the whole system. And that's why I tell my patients, have you seen a car running for more than 100 years? So this is the human system. This is the longest vehicle that you must be traveling or traversing. So we need to respect our body. And how do we respect this? We need to be close to nature. So nature-wise, what I will say is, we look at our diet, 2/3 of our diets have to be vegetarian. It has to be fruit-based, vegetable-based. So what is this system? What does this actually do to our body? Is it makes our body alkaline. Okay. And an alkaline system is something which is optimal for the human system to work. So alkalinity and acidity are also being provoked by emotions. Fear, anger, ego, depression, all these will increase our acid system. While alkaline, you can make it by being happy, joyous, ecstatic, compassionate, gratitude. Nowadays you don't see people being grateful to what they have. All the time that we keep this comparing ourselves. So I also tell my viewers, my listeners, there are two C's. There are cancers, which are cancers of our mind, and what is comparison and competition. So when we run in this rat race, we realize what it does to our system, and cancer is one of the biggest result of this. So in this state, if we are looking at what well-being, which is the most important and the key component of our well-being is the state of our mind. So if your mind is at peace, it's more focused, it is self-directed. And that's why we advocate doing prayers, meditation, doing yoga, and it just does wonders.
So well said. I mean, listening to this, I'm so happy that yes, being in yoga has helped a lot of patients, deal with the chemotherapy, the process of chemotherapy, much better than the ones we don't practice. So I think it makes a lot of difference, yoga and meditation. Thank you for acknowledging that, doctor. I must say that. Dr. Tapas, I want to share something very personal. My grandfather, he was diagnosed with cancer when I was in 10th grade. He was really fit and fine, and he was way too healthy for his age. He was 75. So one fine day he found out that he had blood cancer. It was very sudden actually. After that it was just a month. Because he was, like a tiger, I can say. The minute he got to know that, he mentally broke down so much. I mean, as family, how can we, bring that motivating factor in them that yes, this is just a disease. But the minute we get to know as family members, we ourselves, took a long time to digest the fact that how can this man who is so healthy, so fit and fine at 75, be diagnosed with such a dreaded disease? So, with your experience, how important is the role of family members?
Extremely important. I think of course, the patient, whatever the journey that he would take with cancer, but to cope up with all the stress that he would go through during this process, a lot of things depends upon how the surrounding environment is. That is why we counsel the whole family together, and the patient individually, then the family members separately, and then the unit as a whole. So, I mean, it's unfortunate that it took such a quick toll on him. But yes, it is true, there are sometimes when you reveal it, there are patients who just cannot take it. And it is probably not the cancer which has killed, but there are so many other changes which happen in the body, medical issues which may just crop in suddenly, especially the heart and the mental issues, which doesn't allow the body to push itself forward. And then I would say every patient comes with his destiny. Even if the doctor tries his level best, we can only try, and we try to our hilt. Sometimes we're not able to succeed because things are not always in our hand. But yeah, as a clinician, as an oncosurgeon, my motive is always to not to show the grim side of the story at all to the patient. But yes, the caregivers have to be told everything. It is important because it should not come to them as a setback.
Any inspiring stories that you want to share?
Yes, I mean, this is my take on life through our patients. I would say this inspiring story can be giving you a lot of feedback on the various emotions which the patients travel, and through which you also see through them all the various emotions, but we don't get carried away. One, I would narrate an incident of a patient. I don't want to reveal the name. He is a businessman in one of the busiest shopping complex, and he has had cancer 3 to 4 times. And he fought it so beautifully, so beautifully. The 5th time when the cancer sprang, it was like a large, huge, one-gate incision in the neck, which I thought I had to raise my hands and say sorry to the patient. There's something very beautiful which I used to see on the patient side. The patient would come and tell me, what has happened to me? Nothing has gone wrong. He would just dress his room and go to his workplace. So that was something which I was taken aback. In spite of all the odds, the patient still stands strong. And the patient continues to survive. This is 2022 and it's 2024. He took treatment. Cancer had flared, he had emergencies, through which he again came out, and now with immunotherapy, the lesion has entirely disappeared.
Wow.
And then another patient I remember is, it was an international patient. He had lung cancer and we had operated him. He had multiple nodes in his neck, which I thought the patient would not survive for long. And 3 months down the line, he had disease which had spread completely to the lungs, liver, bones. The entire body was flooded with malignancy. But we lost him to follow-up because he stayed in a country outside ours. But 2 years later, when he knocked at my door and I saw,
Oh my God.
are you still alive? Of course, it never came out.
Like
then
literally goosebumps.
Yes, goosebumps. Because when the tumor spreads, when the cancer spreads to the entire system, span is not more than a couple of months. Worst come worse, it can be months, and the best outcome can be 6 months to a year. And when I saw him, he came with his PET scan, which showed complete clearance of the disease. So what do you say there? So that's like, God's play here, and he beautifully responded to immunotherapy. Another patient, he was an IFS, anonymous, and he would walk with that gait of, those administrators. But he had been a chain smoker. So when I operated him, it meant a loss of voice also. So we had put in an artificial voice prosthesis. But he had a very bad grade of cancer, and the pathology which was revealed through the surgical resection also said that it may not be for long that he will be disease-free. And within a couple of months again, he had disease in the lung, which is really bad. But then whenever he would come to my OPD, I would always see that smile on his face. In spite of the fact that the cough was so nagging and hacking, the smile was just, it was something which you would be taken aback that even after all this, the patient is not demotivated at all and he can still smile it through. And it just took a year, probably just lived for a year, and I saw him go. he was like a skeleton. But then he said, and the bye that he said, when it
Oh
was
my
very
God.
touching.
So emotional.
Yes.
Now I understand, you're so patient and you're so humbling all the time.
Yeah, it's an numbing disease. I as a surgeon, whenever I do surgery on my patient, before I take my knife in my hand, I always pray. Because you never know what's going to come when you open up a patient.
True.
Because the radiology may be something, and when the patient is on the table, the situation may be entirely different. Many times you are working on very important key structures, and there are times you are fearful you may damage or something may happen wrong. But yeah, it's spirituality which takes you through.
True. I mean, I can definitely say, doctors are like gods. I mean, to so many of them, you give them emotional support. You give them another life. So I think that's the profession, that it's so justifiable to call you gods, literally. We've seen during COVID also how you all tirelessly worked. Hats off to all the doctors here. I think congratulations to you all on that, to ensure that we all are safe.
But these blessings really work, and the gratitude of your patients pays you a lot in your own life.
True.
And I would say I would thank all my patients. See, as a female cancer surgeon, it is not easy to work in a male world.
True.
And the profession that I am in, majority of my people are males. So for a male patient to trust a female surgeon, it takes some time.
True.
And my thanks and gratitude to all my male patients who trusted in my life.
Absolutely. What is the one thing that you want to tell our young students who are about to graduate from the medical schools and who are opting to get into Department of Cancer and Radiology, for example? What is the one thing that you want to tell them before they start their journey?
Cancers may not be a very easy subject to be dealing with because the emotions of the patients can also be overwhelming and overbearing on you.
True.
So you are seeing a disease which creates negative emotions. So it may not be easy, but if you are passionate, you would love it. And as I said, the gratitude of your patients and the blessings that you get is enormous. And it can happen in every specialty, not just cancers, but here you're giving a life to a patient who's sailing through a dreadful disease. But then there are many more specialties which are very satisfying, and you are connected to your patients, and it can be enjoyable. So my tip would be, do what your heart says. Don't look at what others are doing, and then don't look at the monetary benefits. People, grab a subject because they see it is very much money making. That should never be. And it should be a part of you which will give you that happiness and joy, because you have to pursue it throughout your life. At the end of the day, what's important is to remain happy, satisfied, and joyous with the bliss of this life.
Before I let you go, of course we want a song or a chanting from Dr. Tapaswini, because I know you're a fantastic singer.
Sajna बरसे क्यों अखियाँ सजना बरसे क्यों अखियाँ सावन आए तुम ना सावन आए तुम ना आए तुम बिन तरसे मोरा जिया सजना बरसे क्यों अखियाँ सजना बरसे क्यों अखियाँ